The sleepless parents endure another night of endless crying. Their newborn is clearly in distress, and the overexhausted mother tries to soothe her baby, but nothing seems to work. A checkup reveals news that is not good. The infant girl has had an aneurysm where her TGA switch was performed. She will need another surgery, and soon. The operation takes place and more complications arise. The baby is diagnosed with pulmonary stenosis, a condition where the pulmonary arteries are stretched beyond capacity. 3 stents are implanted to keep our pulmonary arteries open over the course of 3 years. The surgery works, and thankfully years pass and the nightmare fades. Time passes. The newborn grows to become a young girl, but at 8 years old, her normalcy is shattered once again. She will need another open-heart surgery to further open the stents that had been put in years before. This is a turning point in the young girl's life, but not for the better. After the surgery, the little girl is never the same. There are changes not only to her physically, but emotionally as well. She is angry, disobedient, violent. She struggles in school. Day-to-day tasks become difficult to accomplish, and the child is not herself. Her parents struggle for years to find help, but it's years too late when it finally arrives. She is now 14 with just a few short years left in the pediatric healthcare system. She is rushed through different therapies to try and set her up for success in adulthood. Now that we looked at all the statistics about CHD, we need to talk about the many aspects of CHD. Let's look at them. Physical struggles. There are many different physical struggles that a child deals with. Number 1 is nerve damage. Nerve damage can occur during open-heart surgery. A child's arms are raised for hours above their head so the doctors can easily work during surgery. This can cause nerves to be pinched and damaged. This can hamper the development of the child's hands. These dexterity issues can lead to poor fine motor skills, which is often permanent. Permanent nerve damage also occurs in the chest when it is cut during surgery. These injuries result in sensitivity issues and chronic pain as the nerves try to heal and grow. Nerve damage can be influenced by multiple procedures as doctors cut through previous incisions to limit the amount of scars on a child's body, resulting in lots of scar tissue. This brings us to number 2, scar tissue. Scar tissue doesn't affect everyone. Some children are more prone to it than others. It can depend on the number of surgeries a child has. Scar tissue can lead to puckered and bumped scarring of the skin from reusing incisions. Scar tissue is also internal. It can build up inside the heart, leading to complications in the future, and it can fuse to muscles in the body. When scar tissue grows, it can fuse to your muscles and skin, resulting in nerves becoming pinched and damaged, causing chronic pain. Another physical reality of CHD is chest deformities. Open heart surgery is very invasive. The chest cavity is sawed open through the sternum. Healing is painful. Metal sutures are used to hold your sternum together and are not taken out unless complications arise later in life. The feeling of metal bumps under your skin hurts, and you can't lay on your chest ever because of the pain. It's hard to sit up straight while healing, and the only relief you get is from hunching. This causes your muscles to become tight, leading to further issues involving breathing and spinal issues. Number 4, stomach problems. Many children have stomach problems after surgery. Surgeons will often have to push organs out of the way in babies to repair the heart. When the stomach is moved, it can become misshapen and kinked, leading to issues like acid reflux and heartburn. Number 5, teeth issues. A lesser common issue for children with CHD is oral health. Prolonged use of heavy medications can impede the development of the teeth. leading to higher risk of cavities, marbling of the teeth, and weakening of tooth enamel. Number 6, weak immune system. A sick infant has a weakened immune system, and CHD makes it worse. Their immune system won't build up as strongly or as fast as a healthy baby, giving a higher risk to sickness. A young child with a weak immune system is more prone to childhood diseases, which can become life-threatening in CHD patients. Number 7, stamina. Stamina is a difficult struggle for CHD children. They want to run and play, but for some, it physically hurts to do so. Running can cause chest pain, leaving them breathless. Despite feeling well at times, cardiologists are often reluctant to allow extended activity because of potential pain or damage that can be inflicted to the part and body. The good news is that sometimes your limitations are slowly lessened through exercise, but can be quickly lost if you're going through a poor health period. Number 8 is a critical struggle for CHD children: mental disabilities. While it may not be obvious that mental struggles are a physical issue, there are two main types: brain damage and trauma. Brain damage is common in serious cases. A term used for high-risk infants is blue babies. A blue baby is an infant born with a heart defect, affecting the amount of oxygen the body receives. A lack of oxygen causes mental impairments to the brain. Some damage happens in utero, but can also happen during surgery if you are on a heart-lung machine. Lack of oxygen can cause brain injuries affecting memory, problem-solving, and your IQ. Many children, like the young girl in our story, experience a cognitive issue called developmental coordination disorder. It can be difficult to solve problems and complete tasks because the brain can't communicate with the body. This often leads to outbursts of frustration and anger. The second struggle to highlight affects both family and child: mental struggles. Generalized anxiety disorder. Generalized anxiety disorder is very common in CHD children. A feeling that life is out of control, the child can often be angry, controlling, and disobedient. PTSD. It may not be obvious that a child can experience PTSD, but they can. Trauma can be stored in the body, even as a baby, and can reveal itself as aggression, anxiety, and disengaging later on in life. It should come as no surprise that parents can and often do experience PTSD as well. Watching their child scream in a hospital and feeling unable to help can be traumatizing. Depression. Depression is high risk for a child who is constantly in a negative environment or state. And if you have CHD, the constant worry for your life is stressful. Parents are at a high risk for depression as well. They are so focused on the health of their child, they can eventually break from lack of self-care. As the mother is often the main caregiver, depression is found to be more common with mothers of sick children. Mental issues are, of course, at risk for anyone. However, for children between the ages of 0 to 15, they can internalize trauma that they might not even remember, making life even more challenging for struggling parents. Sometimes a child can worry so much that they even become sick. One disturbing statistic in CHD families is that up to 50% of marriages end in divorce because of the financial and mental strain that the family is forced to endure. Finally, financial struggles can be crippling in today's economy. Here are some examples why. A major financial strain for CHD families is travel expenses. Most CHD patients must travel to children's hospitals, which are few and far between in Canada. Some local hospitals have satellite clinics or pop-up clinics, but few. Something complicating things is that pediatric cardiologists are stretched thin. Specialists are needed for procedures and surgeries and can be lacking even in big hospitals. Hospital travel can be expensive. Since not everyone lives close to a hub hospital, there are many considerations involved: food, lodging, gas, or other modes of transportation, and the cost of time off work for one or more parents or guardians. Another significant financial impact is medication. Many children with CHD require medications, such as blood thinners or diuretics, to improve heart function. If families don't have a medical plan that covers these expenses, the costs can be staggering. Many children don't just need heart medication. A child prone to complications may also require many others. The dollar value can quickly add up. Another factor to the financial struggle is disruption to income. Having a sick child at home can cause many financial issues if you need a dual income. As most families do, when a child is sick, one parent usually stays home to take care of him or find someone to help, which can be difficult. Nannies and babysitters can be very expensive over time. The little girl, very sick, her mom is forced to stay home, hopelessly attempting to balance caring for her sick child, caring for her other child, and taking care of herself. The dad works 6 days a week to help provide for the family. The parents struggle to keep themselves a united front. There were many medications the girl required, and they were not covered under their medical plan. The mother worried day in and day out if they could ever afford the help the girl needed.